I'm Shannon Edwards, and I'm performing a subcutaneous fluid administration. So first thing I'm going to do is I'm going to get a bag of isotonic solution with a fluid administration set. I have already washed my hands prior to this, so I'm just going to set this all up real quick. My doctor had stopped me to ask a question at that moment. So right now I'm just going to flush the bag over there, the line, flush the line, and then I will go and select the appropriate needle and attach it to the sterile administration set, 18 gauge. My camera accidentally got turned off and I didn't know it, so I had to restart the video. That's what that cutoff was. So right now I'm just gonna clean the spot with some alcohol that I'm going to be placing the needle, inserting the needle. So I'm gonna form the tent, which you can't really see, but I'm gonna scrub the top of the tent, so to speak. And then I'm going to take the cap off the needle. And I'm inserting the needle into the door of the tent. I'm going to move the isotonic bag of fluids above the patient. And if I remember correctly, this patient weighed about 44 pounds. So I'm going to do about 200 mLs per spot. And I'm going to do this by gravitational flow into the SubQ tissue space. I'm just trying to adjust the video where you can see what I'm doing. So, a whole lot of standing here. So here I am just massaging the fluids to help them absorb quicker. This patient was dehydrated. He had been vomiting and not eating. He had actually eaten some tissue. and the owners wanted to try treatment before they did x-rays. So Dr. B opted to do SubQ fluids with a syringe injection. I will periodically massage the fluid lump, or the shoulder pad, as Dr. B likes to say, to aid in the absorption of the fluids. He is starting to not like the feel of it here, so he does start moving and adjusting himself. So I'm just going to pick my camera up and move it where you can see better. I'm trying to adjust it. It may take me a minute. I probably could have cut some of this out, but that was honestly more work than I had the time to do. So, I apologize for the long silences. So I'm just massaging the fluid again. Here I am checking the amount that he has received. And he's not quite received all that he needed to as of yet. So we will continue with the fluids. Pretty sure my hands were cramping at this point. I'm just adjusting the camera again where you can see more of the dog. His name is Cisco. He's a very sweet boy. He just didn't feel very well this day. He is being a very good boy, though. So now he has received the amount that he was going to in that spot. So you see that I turned the fluids off. I'm going to lay them down. And I'm once again going to move you so you can see what I'm doing. So here I am. I'm just going to remove the needle and hold pressure over the insertion point to avoid fluids leakage. And after I hold that for a minute, I will then note in the patient's medical record the date, time, and the amount of fluids that was administered subcutaneously.